Okay, this is section 5 of Alzheimer's disease. This has to do with the activities of daily living. Bathing, you need to simplify tasks, allow independence, respect privacy and dignity, do not rush or force the person through a task, be flexible and creative. You need to keep the room warm and a comfortable water temperature. If you're doing dental and mouth care, make sure the person brushes teeth regularly because they are not going to remember. If you don't remind them, they won't do it. Remind and or talk through each task as needed. Be sure dentures fit well, especially when there are changes in weight. Dressing and grooming, allow to dress themselves as long as possible. Give step-by-step instructions and take one task at a time if necessary. Arrange clothes in an order that they are to be put on. Encourage choice, but don't overwhelm. Clothing should be comfortable. Eating, reduce noise, glare, distractions. Avoid pattern placemats, plates, and tablecloth. Sometimes bowls work better than plates. Try 5 or 6 small meals. Monitor chewing and swallowing carefully. Be sure person gets enough liquids, straws, and cups with lids, and also try finger foods. Incontinence is loss of bowel or bladder function. React calmly, do not scold, rule out a medical problem, establish a routine, continued balanced nutrition and fluid intake, keep the door to the bathroom open if possible for visual cues. Sometimes they even put a sign over the door so they see that it's a bathroom. Watch for nonverbal cues, restlessness, pacing, or undressing. Try products designed for adult incontinence, which depends. The family, healthcare is sought when the family cannot deal with or meet the needs of the AD patient. Like it was said, that Alzheimer's lasts about 8 to 10 years. So it's usually about year 4 or 5, the family is like, I can't do this anymore, and they come to the nursing home. So they have been taking care of them for years often, and so they want to make sure you're going to take care of them as good as they were or better. So they may be very difficult to deal with. So you have to be patient and listen. They probably have some helpful cues too of how to help. But once they need help, sometimes they start with home health care or an adult daycare. And then, at the end, they may need long-term care nursing home. The family has special needs. They are stressed out physically, emotionally, socially, and financially. Family members can feel anger, resentment, or guilt, which may result in health problems for the caregivers as well. A lot of times the caregivers, or maybe a wife trying to care for her husband, and she's got her own health problems. Caregivers need support and encouragement. There are AD support groups. There's the Alzheimer's Association. Hospitals usually have groups. The nursing centers usually have groups. Churches and community groups.